Welcome to day 2 of this workshop on the implications of the California wildfires for health, communities, and preparedness. Our ranks are a little thinned compared to yesterday, but thank you all for being here, and thank you for those who are joining us by web. I would remind you that this is being recorded, and the proceedings will be available in a few days on the National Academies website for anyone who may want to view the highlights at that point or relive the experience. So I would ask that if folks could turn off their cell phones or put them on mute since it is being recorded. And all the other things that we said yesterday, whatever they were, apply as well. So originally, we were going to have a different presenter this morning. Our intent was to have someone lead it off with some comments for a variety of reasons and circumstances that aren't important to go into here. Things changed at a relatively late time, and so you're stuck with me for the next 15 or 20 minutes or so. In listening to some of the comments yesterday and reflecting on some of the things, particularly some of the things that were brought up later in the day, I thought I might try to tie together some of what I thought we were hearing yesterday with today and the presentations, because we do have, while there's clear overlap between the health things that we talked about yesterday and what we'll be talking about today, we do have a greater focus on preparedness and resiliency and recovery and some of those issues today than we did yesterday. So I wanted to try to tie some of that together, or at least in a way that I thought might, but also provide it in a somewhat broader or larger context, which brings me to the topic that I thought we could spend the next few minutes talking about. And that is really a question of, can we avert a potential calamity due to the confluence of multiple anthropogenic health conditions that will impact us in the years and decades ahead, which at this point seem to a large degree unchangeable. So with that, just to reflect back on yesterday, we talked about yesterday how California's worsening wildfires are a result of climate change, which is one of the many consequences of the anthropogenic age, or Anthropocene age that we are currently in. And in many ways, the consequences, or the health impacts, as we started to try to define them yesterday, could be considered an anthropogenic health condition, which includes, obviously, a number of different things related to smoke and potential adverse birth outcomes, long-term effects, and many of the things that we talked about yesterday. And I think it was Irva at the end of the day flashed very briefly this report by the Lancet, the Rockefeller Lancet Commission on Planetary Health and this new era. As she did, I would commend this to you. It's a rather lengthy report. As I recall, it's close to 100 pages long, which is a little bit on the long side of articles that are usually covered in the Lancet, for those who read the Lancet. But it is just crammed full of important and useful information. And it's within some of that context that I want to take us for the next few minutes. So the reality is that a substantial proportion of human morbidity and mortality right now is caused by anthropogenic health conditions, and the toll and the health impact of these conditions is going to grow substantially in the years ahead. And a lot of that has to do with the simple human population growth that has occurred. You can't probably read the numbers on this, but I was born back in the early 1950s. I'm not going to tell you which year. But since that time, 3 times as many people who lived on the Earth at the time I was born have been added to the world's population. And if I live to what would be projected as my normal cohort age at this point, at least another 2 billion or so will be added in the remainder of my lifetime. Some of you may reflect back on your basic biology class, whenever that was, and you may remember the story about the deer on the Kaibab Peninsula, or the Kaibab Plateau on the south rim of the Grand Canyon, and which depicted a curve not unlike this, at least the front part. What is not shown here was what happened on the other side of that curve when the population got to the point where it was no longer sustainable and precipitously dropped. Whether that will happen here or not remains to be seen. But there is some reason to think that this curve is unsustainable and cannot continue the way it is. So with that happy note, and by the way, for those who are on antidepressants, I would encourage you to double your dose. For the message is not terribly uplifting at the moment, although there are things that we can do about this. So just to remind everyone that the Anthropocene age, which we are currently in, is characterized as being shaped by human activity as being the dominant force driving what's going on, the dominant influence affecting the planet. As you may recall, over the last 4.5 billion years of Earth, time, geologic time, is divided into different epochs and eras and periods and ages and whatnot. And certainly over the last 650 million years, that has gotten more refined as we've looked at it. But about 30 years ago, people recognized that we are actually in a new age, and it has been called the Anthropocene, and which is generally accepted at this point. And its major characteristic is the fact that it's shaped by human activity. Not surprisingly, there are a number of health conditions that are consequent to this new age. And their hallmarks, broadly speaking, are that they are driven by human demographics and the population changes that are occurring. They're inherently due to the way that we live and our technology and our cultures. And they are interconnected in ways that we don't truly understand as well as we should, certainly if we're going to do something about it. They're catalyzed by the growing connectivity, our global connectivity amongst each other, which is only going to get more and more over time. They don't respect national borders. They are obviously very closely linked to climate and other environmental changes, and there's a long list that one could include among those environmental changes, from loss of biodiversity to ocean acidification to air pollution, et cetera, some of which I'll mention ever so briefly in a moment. And they are due to the interconnections, if you will, between and among humans, the plant world, the animal world, and the larger environment at large. And there are, again, intricate and intimate connections that are poorly understood in many cases. But the bottom line is that they have major transnational political and economic consequences going forward. So let me just walk through at least 8 of these conditions that come to mind. And I would preface this by saying that as important as the discussion is about climate change and what's happening to the environment, it's only part of what we should be focusing on. that we have to focus on the population side of it as well, and they're obviously intimately connected. But much of what is happening is due to the demographic and population changes that are occurring, which are complex, which have to do simply with the growing numbers of humans, with the aging of the population worldwide. More people are now over 65 than less than 5. The urbanization, the fact that in many places, including the United States, our population health has either stagnated or in many places is actually deteriorating. The large migrations of populations that you are seeing as a result of war and conflict and other issues. And obviously in the time I have, I'm just going to hit on this. This is kind of the Reader's Digest 101 version, if not shorter. A second is of these anthropogenic health conditions or family of health conditions relate to climate change and just the deterioration of the environment. This happens to be Indonesia during some of the peat fires that were occurring not long ago. But again, a long list of things from air pollution and ocean acidification and loss of apex predators and the effect that that has and loss of biodiversity, et cetera, et cetera. A second is related to dietary conditions. We are in a somewhat paradoxical world where much of the population, the world's population, is threatened by food insecurity and not enough to eat, and that is likely to worsen when we start thinking about problems of pollination and what's happening with honeybees and other pollinators, and 70% of our foodstuffs are reliant upon pollinators and what is happening there. And the converse is that we have epidemics of obesity and diabetes as a result of that. And so, you know, it's a paradoxical situation, but that the dietary related things are affecting obviously not just this country, but they are worldwide phenomena. As other countries mature in their economic development, these things are becoming more prevalent there. We have a resurgence of infectious diseases, in part due to the antimicrobial resistant pathogens, which, you know, the pharmaceutical companies may continue to crank out new antibiotics, but at the moment, I'm not sure that they're winning the race with the microbes in developing resistance to those antibiotics. And we have a new, relatively new problem in that we have insecticide-resistant vectors. Actually, some investigators here at UC Davis recently called out in Mali the rise of insecticide-resistant mosquitoes. The changing patterns of disease. I remember when I was in medical school, we didn't talk about chikungunya fever, but it is now very much a problem in the Western Hemisphere. Dengue, Ebola, SARS, you know, go down the list of new infectious diseases that we are seeing. And new pathogens continue to be recognized, and then we have issues like the vaccinophobia that is being played out right now, and the return of measles. And in California, we've seen whooping cough and other epidemics in recent years simply because of the reluctance of parents to vaccinate their children. Cancer is, I call out, notwithstanding the advances that are being made in the treatment of cancer, which are in some cases truly remarkable and lots, but cancer is projected to be the leading cause of death in this country and a number of others in the near future. In 2014, actually cancer became the leading cause of death in California. Now in 2015 and 2016, heart disease returned, but it's pretty much neck and neck. And it won't be long before California will join about 24 other states where cancer is the leading cause of death, as well as not too long after that, the United States. And we have a whole array of brain disorders that we are just starting to understand at a significant level. We touched a little bit, but not enough, frankly, on the mental health issues of the wildfires, but we could substitute any number of other terms for wildfires, and there are a growing need for dealing with mental health conditions around the world. We have, with the aging of the population, the increasing number of neurodegenerative conditions, some growing recognition that disorders like Parkinson's may be related to environmental influences, and a variety of other things that fall into this bucket of disorders of brain function, which we are really just starting to understand in a meaningful way. And violence and trauma. You only have to turn on the news every night to be reminded of what's happening in this country and what's happening around the world for different reasons, whether it's terrorism or ethnic or regional conflict or crazy people who have assault weapons or any number of other things. That violence is a growing problem around the world, and that has a number of implications for other conditions such as mental health. And lastly, on this short list, has to do with just the omics and the new medical technology era that we have entered with the genetic understanding, the genetic code, and things like artificial intelligence and what we do with all these big data analyses capabilities. They have the potential to do incredibly good and good things, but they also have the potential to do some things that are not so good. And this is largely a frontier at the moment as far as how we oversee and try to encourage these things in a positive and beneficial way. And not all countries in the world necessarily share the same ethics that I would hope are prevalent here. So with that, just a summary list. These are 8 things that I call out here. I suspect there are some other things that could be added to this list of anthropogenic health conditions. But it's the confluence of these things and how they come together over the next 10, 20, 30 years with all the climate and environmental conditions that portend for potentially calamitous effects on the human population. I don't want to leave on that negative note because there are some things that we can do about it. And I would call out just the 4 things that are noted here. That to begin with, we have to start looking at health through a whole person, whole environment lens. For those of us who have had at least one foot in public health for a long time, this isn't a big leap. This is kind of where we have lived for a long time, but for others in the health community, this is in some ways a revolutionary idea that we have to think beyond a body system or organ system or cells and actually think about all of the conditions which impact human beings. A second thing is recognizing that to deal with these things, we have to integrate knowledge from the life sciences, from physical sciences, social and economic sciences, and engineering. Some have called this convergence science. And start training and developing new types of problem solvers and program managers which can truly understand and operationalize transdisciplinary approaches to problems. And frankly, there are essentially no training programs in the United States at the moment that are taking this kind of transdisciplinary route in training people to think about problems of the future. The corollary of that is that we need more trans or intercontinental collaborations between our academic centers and as well as other partners in that regard. And it's not conceptually all that different. Just to digress for a moment, I currently chair a National Academies consensus study looking at the capital assets of the National Institutes of Health. And we will be releasing a report this summer of our findings. So it isn't public, so I can't talk about them per se, other than to say, because this isn't really news, is that for the past many decades, the seminal organization in the world advancing biomedical research has been the National Institutes of Health. That position is very precarious and quite vulnerable at the moment because of what's happening in biomedical research and what is happening elsewhere in Europe and Asia as far as developing new ways, team-based problem solving, and a variety of other transdisciplinary approaches to solving problems, which has direct implications for the physical environment in which that biomedical research is done. We have to design our facilities in different ways than we have done in the past. We have to quit thinking about discipline-specific research and pathways that are secure within disciplines and start thinking about the transdisciplinary approaches and how we bring teams together that may be located on different continents, that may be far apart, but are focused on solving the same sorts of problems. We also need to start targeting innovations. You can't prescribe innovation, but you can set the conditions and you can set the areas for where we need to innovate. And those innovations are typically going to require new sorts of partnerships and collaborations between academia and business and non-government organizations and community-based organizations and communities, and again, new sorts of partnerships and collaborations to solve the problems that are confronting us. And then lastly, one of the things that we need to get much more serious about is how do we reframe the issues so that they resonate with people? Talking about climate change here in California to the agricultural community, I wouldn't say it's a non-starter, but it doesn't immediately resonate. If we can reframe that issue in terms of economic security and food security and some other things, it's the same issues that we're talking about, but reframe it in a way that makes sense. When we're talking about, again, climate change, and I would say that the Earth has experienced many changes in climate over long periods of time, and it continues to chug along and probably will for another 5 billion years. And so talking about climate change in some ways doesn't resonate. What we're not focusing on is how climate change affects us as human beings who are adapted to live in a very specific type of climate. And when we start thinking about that, as a military community has, as a national security issue, and in looking at it through different lenses, it starts to resonate with people in different ways. But we need to do this more broadly in rethinking about how we enlist the people that need to be brought on board, how we go out and be evangelists and convert people to new ways of thinking, new ways of doing business, but it means that we have to reframe issues. I'm reminded a bit when we launched the California Tobacco Control Program here in California in 1989. We went through this exercise about how do we change normal? I mean, how do we change how people fundamentally think about tobacco use? And there was a whole different cascade of events and things that we pursued than if we had thought about it in terms of people need to be educated. They need to understand that smoking is bad for your health. Yeah, right. But when you take that step back and take a different look and reframe the issue, you can have dramatic success. And indeed, I would posit that the California Tobacco Program is a case study in how you can have dramatic change occurring in quite a short period of time by rethinking about what's the new normal, what's the problem that we're trying to solve, how do we bring people on board to this new way of thinking, which is 180 degrees different than what we thought about it yesterday. So I've gone over the allotted time, but we started a little late, so that's my excuse. So let me turn now. We shouldn't lose sight of this image that we live on a very special planet. to where we are today. So I am going to ask David Eisman to bring his panel forward. Over the course of today, we're going to be talking about issues related to recovery, how we might enhance our operational response to wildfires in particular, but there's a lot there that's generic to disasters more broadly. How we start building in mitigation, preparedness, and resilience into our communities as a regular standard operating procedure. And then I'd like to end the day somewhere around 3 o'clock or so, a little after that maybe, with some reflections, and I will ask our moderators to come forward on a panel at that time. And the question that will be posed to them is, what are the 3 or 4 major takeaways that you are leaving these 2 days with? And I announce this now because I would like all of you to think about that and to join in the conversation later this day. That what are those big ticket items, the big things that we should be thinking about as we go forward, and that will inform the report that we will prepare over the next several weeks. So with that, David?